guys, it's been a minute again. To be honest, I just haven't really been up to videoing. This recovery from Haglund's surgery and the fusion has been exhausting, like so much work. Don't know if I mentioned in other videos or not. I've had a couple falls and a couple more close calls, and just everything you do takes extra effort. And I'm now 8 weeks and let me see. Well, yeah, about 8 weeks post-op. And I've had a follow-up about a week ago, and I'm allowed to partial weight bear with assistance. And it's been interesting. Like, the partial weight bearing part is okay, but the physiotherapist that I have coming in, I'm finding is absolutely useless. He doesn't give me any direction at all. I have to like pull it out of him, ask him questions, and I feel like he's actually holding up my progress at this point because it's so slow. Like, doctor's orders, I still need to be in a boot full time, except when I shower, and when I sit down, I'll take my boot off to give my foot a break from it. But as far as any weight bearing or going anywhere, I have to be in the boot still 24 hours. That's the doctor's orders. But as far as the physiotherapy orders, I get none from the physiotherapist. I have to pull them out of him to see what I'm supposed to do and how many repeats and how many times a day. It's just like, oh my goodness, he comes to my home. He hasn't brought any stuff. He hasn't showed me anything. He hasn't even looked at my foot. It's just like the only thing he's done is bring me a walker that didn't work for me to help me with balance because of the falls. And then I ended up having to get another walker where I can lean on it, like lean my forearms on it, because a regular walker just took out my wrist really quick with the arthritis that I have and such. So he brought me those things, but I had to pull answers out of him for what am I supposed to do, for how long, and how do I walk right in the boot, and oh my gosh, it's been brutal. So, and the doctor just gave me a piece of paper that he gives everybody that has Haglund surgery, and I'm not on that schedule because I'm a month behind because I had 2 surgeries on my foot. So I'm like pretty lost, and I've just been doing my own exercises. Like, I do the one that the therapist told me I could, but then I do it more than twice a day, which is what he said, and I do a couple others a couple times a day so that I can actually get walking. At this point, I don't even know if I'll be walking at 12 weeks. It's so frustrating. I get that it was supposed to be a long recovery, but I think they're setting me behind. Like, you know your own body, right? You know what it can do, and you know the limit. And you think the physiotherapist would actually check that out as part of his job, but he doesn't. So, it's just so frustrating, the medical system. At least I've got someone coming in, but if it's not going to be helpful, then it's not worth it, other than getting the walker. So yeah, I could partial weight bear like 25%, and I've also lowered the lift from 30 degrees to 20 degrees in my boot. Again, the physiotherapist didn't give me that direction, other than you could lower it slightly 5 degrees and wait 2 weeks. Well, I'm behind, so I'm kind of going by what the doctor was saying too. So I lowered it 10 degrees over the course of a week, and then from there I'll wait 2 weeks to lower it again till I get to walking in the boot at a 90-degree angle, which is the goal before I see my surgeon next on May 23rd or 4th, May 23rd, I think. So yeah, that's the update. I'm just trying to think. Oh yes. You guys, if you've watched my other videos, you'll know that I've been struggling with an ingrown toenail that's causing terrible infection. I've had a partial toenail removal, I've had a full toenail removal, and then in my last surgery 8 weeks ago, the surgeon again cut off the corners of both my sides of my toenail because it was ingrown or infected again. And now it's infected again, like bad. And the surgeon and I discussed it, and he's put me on a 2-week course of antibiotics, which I finish tomorrow, to see if we could get it under control, because my right foot is showing signs of CRPS. So we don't want to do any more surgery or any more procedures, which is what will be necessary if I can't get this infection under control. Well, I'm at almost a 2-week mark with the antibiotics, and the infection's still raging. I've had this infection for a year to a year and a half now, and it's not going away. I'm actually surprised it hasn't spread. Oops, sorry. I'm surprised it hasn't spread. At least I don't think it has. I hope it hasn't. And I've done everything at home I know to do to take care of it, and it's just not going away. So I may be facing either another partial toenail removal with the chance that it will come back again and continue the infection, or a full toenail removal and then burn it so that a toenail will never grow back again. Now, any of you who've watched my other videos know that anything dealing with my toenails freak me the heck out. And I've already been through this now 2 times where I've been aware, and it is freaking painful. I just don't want to go through it again. I'm terrified. And how's it going to set me back for trying to get back on my right foot? Like, I'll have a raw toenail bed again, and it's awful. And trying to care for that while being in a boot, or trying to even having a raw toenail bed while being in a boot. Oh my gosh. But it's looking like that's what's going to happen, because nothing is fixing this. Yeah, it's frustrating. I almost have to laugh or I'll cry, because it just won't give up, and I need a break. I need a break from procedures. Like, to have this procedure, I would be, sorry, I'm not really like focusing, am I here? To have the procedure, I'll probably need to be at least heavily sedated, if not put out, because I can't move with my foot from, the Achilles tendon surgery. And it's excruciating for me to get the freezing needle. And I wouldn't even be able to hold my foot the way it's held to do this if I were awake. So I probably have to go under again. And I'm still waiting, and have been for probably close to a year now. I'm in the system to get an endoscopy done for esophageal issues that I've been battling. So who knows when I'll get the call for that. Like, it's just one thing after another, and being under anesthesia so often is so bad. Anyway, that's my update. I do have a little bit of footage of my last follow-up appointment, not a whole lot, but I will add it to the video. How are you all doing with CRPS? Oh yeah, CRPS. That's what my channel is about. Oh my gosh, trying to bear all the weight on my CRPS foot has been also brutal. If I need to get anything done, I'm in my wheelchair. As far as getting back to walking, I'll take the this new walker that I have and do some laps until I can't take it anymore. And it's usually my CRPS foot that gives out before my surgical foot does. I just can't take it. It's brutal. Ugh. I mean, losing the ability to walk is a big deal. It really is. It's life-changing. It's frustrating. It's exhausting. And you got to learn a whole new way of life. But anyway, guys, I'll end this now because it's already much longer than I wanted it to be. I'll add the footage in. There is hope. Hope is a good thing. See you in the next one. Waiting again at the clinic for my 6-week follow-up. I'm just waiting to get x-rays done. Back here. This is our old hospital used as a clinic now. In the procedure room, it's just curtained areas, really. I don't know why I'm in the procedure room. I don't have any procedures. But I'm just gonna go down so oh. Yeah. Getting my foot checked. Call me. Haha, that's funny. This is my heel at 6 weeks and 4 days. Just waiting to see the doctor for a follow-up. This is my toe at 6 weeks and 4 days. Just waiting to see the surgeon for a 6-week follow-up. 6 weeks and 4 days. Look at my foot moving involuntarily. And the infection I gotta get dealt with again.